Okay, let's dive into a really fascinating medical case. This is a story where a patient's own body is, well, basically lying to the doctors who are trying to save his life. He is critically ill, but one of his most important vital signs is telling a completely different and very dangerous story.
So here it is, the central mystery. This man is bleeding internally. He is in shock. His body should be screaming for help. And usually, the first and loudest alarm is a racing heart. But for him, that alarm is silent. And the question we have to answer is why? All right, take a look at these numbers. On the one hand, you've got a blood pressure of 84 over 62. That is dangerously low. That is a textbook sign of shock. But then you look at his pulse, 74 beats a minute. I mean, that's completely normal. These two numbers just don't add up. They're telling us two completely opposite stories. So what else do we know about this guy? He's 59 years old and he's confused, which right away tells us his brain probably isn't getting enough blood. He's got dark, tarry stools, a classic, unmistakable sign of a major bleed somewhere in his gut. There is absolutely no doubt this man is in serious trouble. And that little detail at the bottom, his history of hypertension, that is a huge clue. We're going to come back to that. Okay, so how is the body supposed to react when something like this happens? To figure out why the alarm isn't going off, we first have to understand how that incredible built-in alarm system is designed to work. It's a system that has evolved over millennia to keep us alive. So the official term for what he's going through is hypovolemic shock. It sounds complicated, but it's pretty simple. Hypo means low, volemic means volume. He has low blood volume because he's bleeding. You can think of it like a car engine that's running out of oil. There's just not enough fluid for the pump, his heart, to circulate to all the important parts. It is a true medical emergency. Now, the body has a very clear playbook for this exact situation. First, little sensors all over your body detect that dangerous drop in blood pressure. This immediately triggers the fight-or-flight response, the sympathetic nervous system. And what does that do? It floods the body with adrenaline, which has one simple, urgent message for the heart. Pump faster, pump harder, make up for the blood we're losing. It's an all-hands-on-deck emergency response. And that super fast heart rate has a name, tachycardia. For a patient in this much trouble, you would absolutely expect their pulse to be over 100 beats per minute, probably way higher. It's the body's most reliable distress signal. But our patient? He's just cruising along at 74. The alarm is completely off. So if his body isn't following its own emergency playbook, what's getting in the way? Something is physically blocking that emergency signal from reaching his heart. The clue isn't in the shock itself, it's hidden in his medical history. A tiny detail with massive consequences. The whole entire mystery, it all comes down to a pill he takes every single day for a totally different reason. This is where we find the culprit that silenced the arm. Remember we said his history of hypertension was a key clue? Well, he's being treated for it with a very common class of drugs called beta blockers. And here's the crucial part, what do beta blockers do? They work by suppressing the sympathetic nervous system. Yeah, the exact same fight-or-flight system the body needs to use to sound the alarm during shock. All right, now we can connect all the dots. You have a body that is desperately trying to activate its emergency response system. And at the same time, you have a drug whose entire job is to keep that very same system quiet. It is a perfect storm brewing inside this patient. So just look at the difference here. In a normal shock response, the sympathetic system hits the gas, adrenaline flows, and the heart rate just skyrockets. But in our patient, the beta blocker is actively blocking those signals. The body is trying to scream for help, but the medication has its hand over its mouth, blunting its ability to respond. Here's the best way to think about it. His body, sensing extreme danger from all the blood loss, is flooring the accelerator pedal. It's screaming, go, go, go. But the beta blocker, just doing the job it was prescribed to do, is simultaneously pressing hard on the brakes. And the result? A heart that just can't speed up, even when it desperately needs to. And we can be really confident this is the answer. We can rule out the other suspects. It's not some other part of his nervous system kicking in. And his diabetes medication, glucophage, doesn't do anything like this. The beta blocker is the only thing that fits all the facts. It is our smoking gun. Case closed. So, what's the big lesson here? Why is this more than just an interesting medical puzzle? Because in a real emergency room, this is a life or death situation. And it all comes down to understanding this idea of the deceptively normal patient.
This quote from the source material just says it all perfectly. The beta blocker can make a patient who is in profound, life-threatening shock appear deceptively mild. You look at the monitor, you see a normal heart rate, and you might think things aren't so bad. But it's a dangerous lie, and it's masking the true severity of the crisis happening inside the patient's body.
And that's really the powerful lesson from this case, isn't it? A number on a screen is just data. It only becomes useful information when you put it in context. Without knowing this patient was on a beta blocker, a doctor or a nurse might seriously underestimate how sick he is, and that could delay the critical, life-saving treatments he needs right now. This case is such a powerful reminder that a patient is so much more than a set of numbers. It forces us to ask, what other hidden clues, what other medications, what other conditions hiding in someone's history could completely flip the script on what their vital signs seem to be telling us? It's a question that every clinician has to answer with every single patient, every single day.